Again to this session on the effective vaccine management. And the session we are going to facilitate is are the country meeting the EVM standard. You know that the EVM is stand for Effective Vaccine Management Assessment. It is a global initiative that is led by WHO and UNICEF jointly and now supported by global partners. It just helps to countries to assess their supply chain performance in order to address area for improvement and strength area for sustaining. To facilitate this, to discuss this session, we have called a distinguished panel, all experts in their area. Dan Brigden, who is the secretary actually of the EVM in Geneva, WHO Geneva. He has extended experience in the EVM and managing all the countries' EVM platforms, followed by Paul Colloren. Paul was the main consultant when we have rebranded the EVM 2.0 in 2019, and now we have that tool have been launched 5 years from now. The next speaker will be Nora. Nora will have to share some perspective from the regions to see how the EVM actually can be implemented and roll out in the region just to help fixing the supply chain weaknesses. And then the next will be Modibo Diko. Dr. Diko is now working a consultant at the Balanza Institute, TBI shortly, but he was instrumental in the EVM1, has coordinated within the optimized project the launch and development of the EVM1 in 2009. And finally, our chair, Olamide, from UNICEF Program Group, who will be presenting the perspective on that. Without further ado, I will just want to call the first presenter, I think it's Modibo, for the insight on the EVM in the countries.
Thank you. Okay. Solo? Here? Yes. This one? And back. Back here. Pointer. Okay. Okay. Thank you, colleagues and friends, for giving me the opportunity to talk before you. Our topic will be from EVM1 to EVM2, is progress taking speed? To answer to that, let's listen to the graphs. You can see on the graph on the left-hand side, the blue bars for the initial period 2010-2012, and the red bar for the intermediate period 2017-2019. Between the two periods, you can see that there was a limited progress, 8 percentage points on average. And on the left-hand side, we have the results from 49 EVM2 assessment across the world. And we can see there was a small progress. We have a progress from 69 in the intermediate period to 73, which is 4%. But the time is short compared to the other one. Maybe we will do more than 8% if we give the country the same interval of time. Let me explain something. In EVM1, E9 was the criteria for supporting support functions. But in EVM2, E9, it deals with waste management. So I replaced E9 by the average of the M criteria, which deals with management, forecasting, planning, supportive supervision, and monitoring. So I replaced E9 with the average of the M criteria, so that I have something comparable between the two. If we look at the graphs, we can see that in the initial period, only one criterion scored above 70%. In the intermediate period, 4 criteria, and in the current period, 7 criteria, which is very good. But if we look at the other one, the scores above 80%, we have 0 criteria in the initial period, 2 in the intermediate period, and then again 0 in the current period, which is a bit surprising, and we have to look at it to see what explains that situation. With my artistic talents, I drew these lines above the bars, and you can see that 2 mountains are designed on the left-hand side, one on criteria E3 and E4, which represent capacities and infrastructure, and one above E8, which is more or less training. And we have a depression above criteria which are linked to human factor, E5 management, E6 stock management, and E5 maintenance, E6 stock management, and E7 distribution. And we have a precipice above the E9 criteria, which is support function, particularly supportive supervision. And this criteria managed to even decrease between initial period and intermediate period, which is surprising. If we look at the graph on the left-hand side, we can see that the mountain has been somehow flattened, and because the process criteria have slightly increased, E5, E6, and E7, but surprisingly, the input criteria, E3 and E4, and even E8, have decreased for some reason. And we have to probably do some studies in the countries to find out what are the reasons behind this decrease of input criteria score, because countries have been benefiting from a lot of support from partners and from their own governments for capacity, infrastructure, training, etc. Despite that, the score has reduced somehow. So we have to find out what explained that. So probably some studies will be necessary to clarify that. So this is the Pablo Picasso representation of the 2 mountains, which are called the Mount of Having, capacities and infrastructure, the Mount of Knowledge, E8, and the depression of will, because human factor is involved here, and the precipice of power, because supportive supervision is done by the hierarchy, so it's a precipice of power. On the left-hand side, we can see that we have hills now and not mountains. But this, anyway, the depression of will still persists. And why is this depression of will still persisting? It is urgent to act to solve that problem, because we can see that the distribution score is low, 70%. Management scores are low, 69%. The score for the policies and procedure criteria is also low, 66%. And because of that, it's not surprising that the performance indicator for availability is such low as 50% across the countries. It is urgent to act because of this low availability. It can be problematic for the countries. And if we look at it, all these 3 criteria which are mentioned, A, B, C, are linked to human factor. Human factor is involved in all these aspects. And the reason of that is that managers continue to neglect behavioral components of management. I read from a book, let me read. Quite often, when managers try to implement business processes, they only focus on structural components. These efforts have high failure rate because even though the right structure is in place, the right behaviors are not encouraged. the behavioral components are critical success factor, say this author. If you managers focus mainly on structural components of management, planning, control method, workflow, organization, communication, etc. And they neglect the other side of the picture, the behavioral components linked to which management methods are being used, how authority and leadership is exercised, what system of risk and reward is in place, how culture and attitude of the staff are taken into account, and how managers build trust and commitment with their staff. This is absolutely necessary to add to the other components so that the motivation is really boosted among the staff. So that should be our direction in future training, advocacy, and sensitization program for both program managers and supply chain managers. And that's those who have watched my presentation in May this year on TechNet on the subject called EVM, why progress is so slow, will remember that because supportive supervision was low, was neglected, the staff had the impression that what they do is not interesting for management. And that had a negative impact on their self-esteem and motivation. So the solution, we said, is to revitalize management functions, supportive functions. And if we do that, we will boost self-esteem and boost motivation of the staff, and they will do their work better. And the depression of will be filled, and we will have a plateau of will. It looks simple, but it's not happening because we have seen the scores for management factors and management criteria remain low even now. And they remain low. We have to adopt this new paradigm to give priority in our training, advocacy, and sensitization, to give priority to leadership and people skills in those efforts. Thank you.
Thank you, Modibo, for this anthropological aspect of these lenses from behavioral aspect of on EVM scores. Now, Olamide.
Thanks. Thanks, hello. I'm not Dico Picasso, so I wouldn't be able to give philosophical perspectives, but thankfully there are tools that could help us to dive deep into some of the things we see in the EVM. So today, just briefly talking about what have we seen as evolution of immunization supply chain performance in the last from 2009 to now. So first, to start with, to say that the EVM assessment has been conducted in 73% of the world's population. So countries that represent up to 73% of the world's population. We think that is huge because it means that take out high-income countries who perhaps would not do an EVM. The EVM has pretty covered a large percentage of the globe. And that's why we think that it's extremely important to continue to improve, refine, and scale the EVM appropriately, and it continues to be a priority of this community. That said, we also see a fairly equal share of Gavi and non-Gavi countries that have implemented the EVM approach. And I think this is instructive. It will tell us that whatever we see as the data would fairly not just represent low-income countries, but also middle-income countries. And the perspective will be important to see how we support and how we generate domestic resources to ensure that some of the findings are addressed. Now, we see that there's been steady progress. Modibo has shown nicely, but we see that there's steady progress in the last couple of years, over the years in supply chain performance, right from 2009 when a lot of these costs were low to about 2018, where we can say that we have a steady increase in EVM composites costs. But as we see, leading from 2019 thereabout to about 2023, there seems to be a somewhat plateauing of this cost, which means that we need to, of course, it's easier to improve from a lower score than it is to really continue to improve on a high performing score. That could explain one of the things. But what is also instructive on this slide is the comparison of Gavi supported and non-Gavi supported countries. And I think that's instructive. The darker blue is Gavi supported countries, and you will see right about somewhere in 2017, you see a crossover and a relatively higher performance in Gavi supported countries, which means that this community is doing something good in strengthening these, the supply chains in these countries, which also means that we cannot afford to neglect middle-income countries that are not Gavi supported, or that were Gavi supported or donor supported, but that have transitioned at one point or the other out of Gavi support. And that's extremely important to continue to put in perspective. Yeah, this is busy, but we could walk through it. So to say, so there are charts that tells a compelling story of what we see. First is the fact that vaccine management is the only criteria that crosses the minimum EVM standard. That's as Musibo showed, and you're seeing on this chart, it means that it's a success story because it means all the efforts we've done, WHO, UNICEF, but PATH, CHI, GSI, and now I'll be short because I'll miss some organizations. That's not everybody in the room. I've contributed to everything that you see, Village Reach, everybody, private sector. I've contributed to really upskilling countries to get to this level of a better supply chain performance around vaccine management. We also see that storage and transport capacity follows closely, slightly less than 80% minimum standard, but quite high relatively to others. And this also underpins significant investment that has gone into the space, especially in the last 7 years with CCOP. But before also, through HSS investment, storage, transport capacity have always been a priority investment. Distribution is the lowest criteria. Modibo pointed that out. So that would extremely mean that if we are not looking at distribution assets, systems in country, especially at the last mile, then we will not be moving the needle of contributing to availability, potency, and quality. And that's extremely important, and that's a key takeaway that we should take from this. In the management criteria that started with recent EVM2 assessment, we see that ISC performance monitoring is the lowest criteria, and that speaks to some of the depression of will that Modibo talked about. And more importantly, it means that we must support supply chain managers, health workers, EPI program managers in country to really invest in that strategic oversight of the system, strengthen the governance mechanism in system to make sure that they're on top of how their systems are performing, identifying bottlenecks, and being able to design mitigating steps. That's extremely, extremely important. So we also see generally steady increase up until 2018, a plateauing or really mixed picture compared to when we look at the composite score, but we see plateauing of E3, E8, M1 functions, but a gentle increase in others, but a dip also in M2, M3, M4. So those are extremely important things that we must always consider. And these were Gavi-supported countries. Remember, these were Gavi-supported countries. So if we look at the middle-income countries, we see that it's important to continue to invest, like we said earlier. There's a general plateauing of performance, and just storage and transportation capacity has actually been higher than 80%. So it's extremely important to continue to support middle-income countries in strengthening their systems. Sometimes it's a higher order engaging in middle-income countries because it's perceived that the systems are functioning. But I think one of the panelists had said this week, and I think that was very instructive, I've never seen there are no bankrupt systems, there are no bankrupt lower middle-income countries health systems, that all Ministry of Health are bankrupt. Well, maybe that's debatable, but that's instructive if we look at the numbers to say that we must support middle-income countries also health systems. Now, it's important to see what's happening across the levels of supply chain systems. And we need to, and the message is that we need to invest in last mile supply chain systems. As we see, the lower you go in the supply chain, the lower the performance. And we make this anecdote to say that there's no primary store or central medical store that you go to, small country like Cabo Verde or big country like India, that you not find a refrigerated truck, at least one, in the primary store. But then take the trip to go to all health facilities. As you go down, you see that the responsibility continues to be outsourced, resources continue to be patched, and that's the story we're seeing here. Significant investments need to be made at last mile to make sure that we can achieve our goals. Service delivery points are least performing, and we see a general plateauing of supply chain performance across level like we see in trend. Now, this tells an important story of transition countries, especially Gavi-supported transition countries, and you'll see the accelerated transition phase countries in lighter blue color are lower performing than in preparatory transition phase and especially initial self-financing countries. And that's important in the support we provide to these countries as they transition out of donor support, how we support, give them the tools to encourage domestic resource mobilization and prioritization appropriately in the health systems. Now, we are supporting countries to also understand better, and our colleagues at Gavi and were discussing a couple of weeks ago, and we were talking about a number like this that would always support countries to see what's the progression between EVM assessments for particular countries, to be able to troubleshoot where should we be investing and how it informs your full portfolio planning with Gavi, domestic resource raising, donor coming up saying we want to buy X. As we've seen, there's been a lot of investment in infrastructure. The number priority may not be other things that are revealed here. This is an example country, by the way, real data, but just not showing the country name. So you see from the 3 assessments that this country has conducted, you see like graduation improvement successively from the first assessment in 2010 to 2019. And this tells a story, but this also would identify gaps that they need to invest in to sustain some of the improvements that they've seen, or to actually mitigate some of the challenges they would still see. So thank you. Hope that provides a bit of overview of what we're seeing, and continue to engage. Thank you.
Thank you, Olamide, for this insightful presentation. So now I want to call the other panel members. Dan, can you just...
Thank you, Solo. Thanks, Olamide and Modibo, for 2 great presentations. We've just pulled up the heat map here as a final slide for a couple of observations. If you're unfamiliar with EVM and you're a little lost at certain points in those presentations, you might want to refer to the keys there, the E1 to E9 and M1 to M4 on the left side column, which talks of the EVM criterias. And on the top row, the EVM categories, infrastructure, equipment, information technology, etc. This is what we've been talking about. And I should also point out that this heat map that you're looking at here is the composite score of the 51 national EVM assessments that have been validated by the Secretariat up to the present date. And in the bottom right-hand corner is the composite score. My job in the EVM Secretariat I would be amiss in not pointing out that all this data is available on the evm2.who.int website. And underneath every single cell in this table is a mountain of very rich data. It's aggregated, so you will not be able to find country-specific scores here, but you are able to apply filters such as supply chain level, WHO region, UNICEF region, et cetera, et cetera. And there are 900 different requirements assessed by EVM, and there is a mountain of data here. There are probably many dozens of PhD theses waiting to be discovered in this data, and we have not yet taken the machete to this jungle of data as much as we should have, so that's something we should prioritize. But I don't want to be late because I'm sort of been criticizing everyone for being late in their presentations, and I'm taking more than my allotted time. So I just finish by observing that Modibo's presentation talking about the depression of will versus the mountain of having was very stark and very interesting, and gives us a very quick and immediate inroad into understanding some of the findings of EVM. He talks about the behavioral components of management versus the structural components. One might simplify that a little bit to people versus cold chain equipment, or even further, meat versus metal. And I think that we've had various other TechNet conferences where we've sat on stages like this and spoken about the importance of the supply chain workforce, professionalization and other initiatives. And I think that we still have a long way to go in that regard. But I'm sitting next to an expert here in EVM, so I won't take any more of your time. Thank you.
Thank you, Dan, for your reflections. Now, Paul, you've seen this presentation. What are your thoughts on that?
There was one particular slide which I would like you to go back to, Olamide. I think it's slide 6. Great presentations, guys. Well, keep going back. It's the one with the, yeah, that one there. Yeah. This, I saw this slide for the first time a few days ago, and I'm sure Gavi loves this slide. But it actually has much more information in it than you might at first be apparent. This is actually EVM in action, this slide here, because the light blue flat curve, that's non-Gavi eligible countries, and most of those countries have done 1 or 2 assessments. Some might have done 3. So, you know, EVM is a continuous improvement process: assess, plan, implement, assess, plan, implement. The Gavi eligible countries, thanks to Gavi, because they encouraged countries to adopt the EVM continuous improvement process a long, long time ago. So most of the Gavi eligible countries have done 3 assessments. Many have done 4. I think some have even done 5. So they're really into this continuous improvement process. And the dark blue curve is a demonstration of of EVM in action. And it's largely down to Gavi pushing those countries from a very early age to implement the EVM program. But as Olamide pointed out, it does seem to have plateaued. But if you go back to that slide that Dan showed, the one at the end, that dashboard actually reveals maybe a couple of low-hanging fruits that we could probably focus on if we want the EVM KPI to keep going up. You know, those of us who know how to quickly interpret this dashboard, this is for the 51 countries that have conducted and validated EVM2 assessments. Of course, there's many, many more assessments from EVM1. This is just the EVM2 data. And there's 3 things initially that just pop out. The big yellow column, C5, this is telling us that countries don't have SOPs in general. Right? So this is telling us across those 51 countries, we could improve the composite score of these countries simply by addressing that particular weakness. The 2 other reds, I think, are quite interesting because there's been lots of discussion about this for the last 3 days. The one on the top right is basically telling us that countries don't have cold chain equipment inventory management systems. That's what that red there means. And the red at the bottom is telling us that countries do not monitor the performance of their supply chains, right? And this has been talked about a lot. So I think this slide here and the slide in Olamide's presentation do demonstrate that EVM does have an impact in improving supply chain performance.
Thank Paul. Now, Nora, from the regional perspective and the countries, what are your appeal here on this EVM session?
Well, thank you, Solo. Basically, my message is goes to those countries that are participating here and those that are following up a live stream. is we are encouraging them and we invite them to use this tool that, you've been here listening and see the results about all this, the TechNet, but also this management tool as the EVM now is digitalized. So this is the improvement for the cold chain, supply chain, and vaccine management. So we would like just to work with them. Now we are training in this new version, the 2.0, sorry. So yes, we hopefully that we can expand this EVM tool in the Americas. So we are working very hardly with training healthcare workers in this new version. And we hopefully that we have to start with 2 countries next year and going more and more because you can see that this is probably the only region that you probably ask why, but we really with the EVM one, we carried out in 5 countries in the Americas the EVM assessment, and now I think we are going to work very hardly and encouraging them to continue using this tool as a best practice and to strengthen the components of the cold chain and supply chain management. Thank you.
Thank you, Nora. With this, I want just to call our panelists to exit with your applause.